Okay guys, so today we're going to be doing unconscious mouth care. So what are my first 5 steps? Okay, so knock, identify, explain, privacy, and hand hygiene. So I'm going to raise both of my side rails. And then raise my bed to waist level. Will you give me a towel or a washcloth? Okay, and what would I need to do before I lower that side rail?
Make sure you have your tray beside you.
Yep, so I'm going to pull my table over here. Let me lower this. So I want my patient to be side lying with their face completely turned, okay? That way there's no risk of aspiration. So to do that, I don't need to uncover them at all. We'll have a pillow at the end of our bed. And I'm just going to use the draw sheet, so the sheet right underneath them, and using that I'm going to roll them towards me, and then this pillow can just go right underneath them. Now they're lying on their side, and I'm going to make sure that my patient's head is turned completely to the side as well. So for this skill we're going to use a washcloth or a towel. It could be either or, it doesn't matter, whatever they have sitting there, as our waterproof pad or our chuck. Okay, so what would I need to do right before I would place that waterproof pad? Gloves. So gloves always are coordinated with our waterproof pad, so I'm going to put my gloves on. And I want this washcloth just placed right under their chin, just mostly to protect their clothing, so nothing gets wet. And then same with this small kidney basin. This is just going right under their chin, just if any water comes back out of their mouth, okay? So to do oral care for them, I'm just using these swabs. They come in a plastic package. Sometimes they're called lemon glycerin swabs, and they're pre-moistened. And if that's the case, I would just go in and start cleaning with them. And then sometimes they're like this and they're dry, okay? There are 5 areas that I'm gonna clean when I'm doing this, and I have to verbalize that to my evaluator because when I stick this in their mouth, they can't really see what I'm doing. So I'm gonna take my first one, every single one of them, I'm gonna dip in the water here, squeeze it, and then check it. And I'm checking it to make sure when I pull it, it's not coming off, so there's no risk of aspiration. So dip, squeeze, check. And I'm gonna start by doing the roof of their mouth. Each time I use one, I'm gonna stick it over here to the side so I know that that one's done. And then I'm gonna grab my next one and dip, squeeze, check. And now I'm gonna do my patient's cheeks and their gums. I'm gonna do my third one, dip, squeeze, check. And I'm going to do the chewing surfaces of their teeth, and then the front as well as back of their teeth. Now I'm going to dip, squeeze, check. I'm going to do the tongue. And then with my last one, dip, squeeze, check. And I'm going to moisten and do their lips and make sure there's nothing on their lips. The order that you go in doesn't matter. As long as you cover all surfaces of their mouth, it doesn't matter the order. Obviously, we want to do lips last because that makes sense. But after that, the order doesn't matter. I'm going to use my washcloth that I have sitting here and just kind of dry their mouth. And then I'm going to apply chapstick. Once I've applied chapstick, I can remove all of this. And this is my waterproof pads, or my chuck, so once I've removed this, now I can remove my gloves. After my gloves are off, I can reposition my patient. So I'm just going to pull that pillow back out. I should never have to uncover them to do that. And just make sure that they are in a comfortable position. And that is that. So now I can raise their bed rail and lower their bed. Make sure that their bed looks nice and tidy. And it's not a bad idea when you're practicing, when you flip to this scale in your book, if you just want to write 1 through 5 and just put the areas that you're going to be cleaning. That way you don't forget them. So roof of mouth, cheeks, gums, tongue, and then lips. And then once my patient is down and my side rails are down, my last 3 steps will be call light, hand hygiene, report, and record.